Diabetes is a disease of the pancreas, which is an organ behind your stomach. Normally, the pancreas releases insulin into the blood. When you eat or drink, much of your food is broken down into a simple sugar called glucose. Glucose provides the energy your body needs for daily activities. Insulin is the helper, or the key, that lets glucose into the cells of the body. When a person has diabetes, one or more of the following things happens. The pancreas does not make insulin, the pancreas does not make enough insulin, or the pancreas makes insulin that the body does not use properly, also known as insulin resistance. Without insulin, glucose cannot get into the body's cells to be used as energy. When glucose cannot get into the cells, it stays in your blood. Too much glucose in the blood is called high blood sugar or hyperglycemia. If that happens, you may need to give yourself insulin. Insulin is delivered into the body by an injection or shot. Insulin can also be delivered with an insulin pump. There are two types of diabetes, type 1 and type 2. Type 1 diabetes occurs when the cells in the pancreas that produce insulin are damaged. As a result, people with type 1 diabetes produce little or no insulin, which means that sugar cannot get into the body's cells for use as energy. This causes blood sugar levels to rise. People with type 1 diabetes must inject insulin to control their blood sugar. Type 1 is the most common form of diabetes in people under 20, but it can occur at any age. People with type 2 diabetes produce insulin. However, there is not enough insulin, and in many people with type 2 diabetes, the insulin that is there does not work properly. When this happens, sugar cannot get into the body's cells for use as energy, and blood sugar levels rise. Type 2 diabetes is most common in people over 45. Some people with type 2 diabetes can manage it by controlling their weight, watching their diet, and exercising regularly. Others might also need to take an oral medicine or insulin injection. Researchers do not yet know what causes diabetes. However, the following factors may increase your chance of getting diabetes: a family history of diabetes, African American, Hispanic, Native American, or Asian American race or ethnic background, being overweight, at least 20% over your desired body weight, have or had physical stress such as surgery or illness, are on certain medications such as steroids, have had an injury to the pancreas such as infection, tumor, surgery, or accident, have an autoimmune disease in which the body attacks itself, high blood pressure, abnormal blood cholesterol or triglyceride levels, age, risk increases as you get older, drinking heavy amounts of alcohol, smoking, having a history of gestational diabetes. It is important to note that sugar itself does not cause diabetes. The symptoms of diabetes include the following: increased thirst, increased hunger, dry mouth, frequent urination or having to go to the bathroom often, unexplained weight loss even though you are eating and feeling hungry, feeling weak and tired, blurred vision, numbness or tingling in the hands or feet, sores or cuts that take a long time to heal, dry and itchy skin usually in the groin area, and frequent yeast infections. There are different blood tests that can be used to diagnose diabetes. One test your healthcare provider may order is a fasting glucose test. This test measures the amount of sugar in your blood after fasting for at least 8 hours. Your healthcare provider may also order the A1C blood test, which show the 3-month average of your blood sugar. You do not have to fast for an A1C blood test. A third test that can be used to diagnose diabetes is an oral glucose tolerance test. This test shows how much your blood sugar increases after drinking a measured amount of glucose. Diabetes is diagnosed when at least one of the following is detected. Your fasting blood sugar level is 126 milligrams per deciliter or higher. You have a random blood sugar level that is over 200 milligrams per deciliter with symptoms. You have an oral glucose tolerance test with results over 200 milligrams per deciliter. Your A1C test is 6.5% or above. There is no cure for diabetes, but it can be treated and controlled. The goals of managing diabetes are to keep your blood sugar levels as near to normal as possible, maintain your blood cholesterol levels as close to the normal ranges as possible, and to keep your blood pressure under 140/90. Achieving these goals can help decrease or possibly prevent diabetes-related health problems, including eye damage, nerve damage, kidney damage, heart attacks, and strokes. Here are some great ways to control your blood sugars. Eat healthfully, be physically active, lose weight if you are currently overweight, lower your stress, limit alcohol intake, get enough sleep, quit smoking, take your medications, check your blood sugar, and keep your appointments with your healthcare provider. What you do at home every day affects your blood sugar more than what your doctor can do every few months during your checkups. To learn more about what affects your blood sugars and how to make changes, ask your healthcare provider for a referral to a diabetes educator and schedule an appointment. We hope you have found the information helpful. If you have any questions, please ask one of your caregivers. Thank you for choosing Cleveland Clinic for your care.